Thank you very much. Good evening. Hey, people have slept. Good evening. Yeah, that's encouraging. I first want to thank the CIM Global, Anita and the team for inviting us to this wonderful event, this Congress. I'll try to be very brief because I can see the time is not very friendly. Mine is a bit different from the other presentations. I'm presenting on guidelines for referral of patients abroad, the Kenyan perspective. I want to mention that as a medical board or any medical council, I know we are viewed as people who are deterrent. That is, we deter progress. But actually, we facilitate provision of quality of health care to patients. So we care about the patient and we care about the doctor or the provider. Sorry, I'm unable to operate this. I press which one? This one. Oh, this one, I was pressing the opposite. Oh. Okay, my presentation will cover the legal foundation of the board, the functions, registration status of doctors and institutions in brief, just to tell you who we are, and then refer of patients abroad and the milestones of the board. The board in Kenya, the Medical Practitioner and Dentist Board, is established under Section 4 of the Medical Practitioners and Dentists Act, Cap 253 of the laws of Kenya, and it was enacted in 1977 and implemented in 1978, January. And the mandate of the board is to regulate the training, practice, and licensing of medicine and dentistry and healthcare institutions in the country, including private, public, and mission facilities. The functions of the board in brief is education and training, registration, education and training of dentists and medical practitioners, registration of this, licensing of the same, inspections of the facilities where interns are trained and where medical practice is carried out, and then disciplinary, of course, when humanity doesn't obey the rules. Advisory to the government, Ministry of Health, and other government agencies, and then collaborations and partnerships, like we're doing now in this forum, and what we continue doing after this, then keeping database and maintaining it, and then monitoring and evaluation, that is performance contracting. This is just a brief on the registration status of our doctors. We have about 11,000 medical doctors registered in Kenya, but those who are actively practicing in the country are 6,000. These are the people who treat 45 million Kenyans, 6,000 medical doctors. Dentists, it's even worse. There are 668 who are in active practice to treat the 45 million Kenyans. Then we have also foreign doctors on temporary license. We have 678 in medical and 21 dental. The rest of the detail is regarding the status of the internship training and the institutions in the country. But I just wanted to show, the numbers of doctors, medical and dentists, and the population as compared to what WHO recommends should be the ratios. Now, let me talk about the referral of patients abroad. The board developed medical practitioners and dentists rules in 2017 to guide the referral of patients abroad for medical management. We did this as one of our routine activities where we develop policies and guidelines to guide various practices in the country. And this time what had happened, it was realized that there are many patients being referred to different countries in the world, And referral is good, and people work well to to refer. But it was realized that some people had made it a business, so that doctors collaborate from the referring institution and to the referral area, so that even when a patient doesn't really need to be referred, they are referred, and then the fees raised from the point of receiving the patient is shared, so that it's a business. So the government requested the board to do something about it, and we did something about it. We developed the guidelines to facilitate quality of referral and care for the patients. So the process of referral, there's what is the requirements, application process. The patient is expected to submit an application form and a referral letter from a doctor within the country, and they are supposed to indicate the intent. Why are they going, and what are the reasons? Then the application or referral form contains the patient's particulars, consent by the patient or guardian or relative, then full disclosure of reason for referral. Of course, this is reviewed by medical practitioners in the board, and it's not, it maintains privacy of the patient. And the practitioner's particulars, the one who is referring, and even the one who will receive the patient, and supporting documents like a comprehensive report by the referring doctor, then confirmation from the receiving institution so that the patient doesn't hang there, and government approval or notification for both the patient and the donor in case of organ transplant. Referral responsibility, both the referring institution and the practitioner have a duty of care to act in the patient's best interest in the following manner. There should be a significant advantage to seeking health care services abroad over the local treatment with proven clinical benefit, anticipation of substantial health gains, a good prognosis, and improved quality of life. Then curative versus palliative or other intent. And then what level of a medical or dental practitioner can be allowed to refer? This one, a registered medical practitioner or dental practitioner in good standing with the board, duly recognized in that specialty or specialty referral, and a minimum 5 years experience after internship for general referrals. And then the reasons for referral where the procedure is available locally, cost, waiting time, patient, that is where the treatment is available locally. Why should somebody go? If the cost is prohibitive in our country and better where they are going, then that is considered. The waiting time may be too long. They may be waiting for many months, but when they are referred, the referral place will attend to them immediately. Then patient choice and lack of capacity, where we have no capacity in the country. Category and accreditation of institutions abroad. The Kenya Quality Model of Health accreditation or equivalent of a level 5. This is a county level hospital in Kenya, or level 6, which is a national referral and teaching hospital. We have only 2 in the country, 3 actually. Kenyatta Hospital, Moi Hospital, and the Spinal Injury Hospital. Then the most frequently visited countries by Kenyan citizens, number 1 is India, followed by South Africa, United Kingdom, and then the other parts of the world, maybe where the relatives live. Provision for follow-up mechanisms, the role of the referring doctor. We insist that they should actually insist what will happen to the patient when the patient comes back home. Identification of appropriate specialist panels and the support teams and the services. Funding responsibility, this can be self, private insurance, National Hospital Insurance Fund, government-sponsored patients like our VIPs, other funding issues like letters of undertaking, direct payment, reimbursement, and retrospective payment as agreed by the treating doctor abroad and the institution. Professional and ethical issues with the prescribed penalties. Of course, not everybody obeys the guidelines and the rules, so there are penalties if there are issues of referral for financial gain by the referring doctor, referral for terminal conditions when one knows that this, really it will not be very helpful to refer, false diagnosis to encourage or to coerce patients to agree to be referred, privacy of the patient, confidentiality, and undue influence. These are some of the issues which can lead to penalties by the board. These are general information where we are interested to know about travel and accommodation modalities because there are nationalities who are traveling and they are sick, possible waivers and informed consent, medical attendance and escorts, airline travel, medical information forms, onboard medical equipment, medical attendant requirements and insurance cover while abroad, and also onboard traveling. These are specified so that patients and relatives are helped. The most frequent medical conditions for referral, they are listed: oncology, cardiology, orthopedics, surgery, neurology, ENT, dental, in that order. Gynecology comes, I think it's number 8, hepatology, kidney transplant, ophthalmology, rheumatology, and urology. So oncology is number 1, followed by cardiology. Then milestones, I won't go through this in detail. I will just, I want to show you that we've been doing a lot of things as expected regarding infrastructure, establishment of our secretariat departments, a strategic management where we develop and implement the strategic plan and other developments, ICT business model. Here, number 5, legal reforms. This is interesting because I wanted you to note that the board has reviewed and enacted the following under Cap 253 laws of Kenya. And we have the Medical Practitioners and Dentists Rules 2017. Number B, Medical Practitioners and Dentists Referral of Patients Abroad Rules in 2017. Just wanted you to see that this is one of the activities because we have many activities and this is one of them, and we did it as routine. The reason why I'm emphasizing this is that when we were developing these rules, we were not viewed very kindly by some people who had this business who were benefiting a lot, because if one is getting a cut or some money or some funds after referring the patient, now from the other side, I refer the patient to a certain country, the doctor who receives the patient changes and gives me money. So if I'm referring many patients, then I continue getting a lot. So when we were developing these rules, we were viewed very, very negatively by those who were doing the wrong practice, and those who were coercing patients, who were getting money from patients unfairly. So I'm emphasizing this so that it is seen. The board did its work as we do many other things. And this is one of the legal reforms of 2017 that we did. And it was done with very good intentions for the good of the patients and even the doctors. Then the milestones still continue. We have several policy documents which are available, most of them in our website. I want to go through them. Then we have international engagements with other medical associations in Africa and the world. These are our contact details. They're available if whoever is interested. And the parting word, as I leave, or parting shot, I will remind you again, the board is facilitatory and it's not a deterrent. We would want the best for our patients and for our population, because that is what our profession demands. So the parting shot is take good care of your reputation and the profession. This will live longer than you and me. So it's good we take good care of them, our reputation and our profession in everything that we do, because they will live longer than you and me. Thank you. Asante sana.